One of the collagen peptides I want to talk about is something called VERISOL. What's really interesting about this one is that there are 7 clinical trials to support its use in terms of connective tissue, which includes skin. The thing that I'm always looking for is the right clinical trial. And what is a good clinical trial? Ultimately, it's double blind. In other words, when you've got a volunteer in your trial, they don't know if they're getting the active or the placebo. Neither does the person giving them the test product. You compare the active one, which would be the VERISOL in this case, to a placebo group over time, and you compare the difference between the two groups. So a placebo-controlled trial that is also randomized is what you're looking for. There are 7 trials behind VERISOL proving it absolutely works. So the thing about it is, like everything, you need the right dose for the right length of time to get the right result. And so when you look at the dose of VERISOL, it starts to hit that therapeutic window. In other words, you start to get to the point where it will stimulate and trigger your body's ability to make collagen at around 2.5 grams. You can use more and the signal will get stronger, but 2.5 grams is the minimum you need. And you need to take it for multiple weeks to start to really change the way your body creates collagen and models things. And then you get the effect. When you look at the studies for skin in particular, the results show that you get improved elasticity, you get reduced appearance of fine lines, particularly around the mouth and eyes, which is typical of what they look for in clinical trials, and also improved moisture. Generally, the integrity of your skin improves, and so you feel the difference and you see the difference as well. It doesn't stop there though. VERISOL also works on nails, so it can accelerate nail growth and make them a lot stronger. Doesn't stop there either. It also works on hair, because ultimately what you're doing is stimulating collagen in all of these connective tissues. So in terms of hair, when you look at the research for VERISOL in hair, when you compare it to placebo, the group that actually used the VERISOL over time started to see that their hair was growing faster, it was also stronger, and there was more thickness. Now remember, these are placebo-controlled trials, so they would have compared that effect to the group that was taking basically something that smelt the same, tasted the same, but was doing nothing. And they noticed this big difference.